right, continuous assessment. Respiratory rate, effort, SATs, vital signs. What's your patient look like? And then ask yourself, what do you think the patient looks like before respiratory arrest occurs? And it's always important to think about that because, as I mentioned before, endotracheal intubation is preferred before respiratory arrest occurs. You've got more of a controlled situation. What that patient looks like before respiratory arrest occurs is typically they wear out, so the respiratory rates may start slowing down. Or if you've got them hooked up to a pulse ox, what you see is the SATs are dropping and the patient's working like a stepchild, and yet the effort is no longer holding them. So that's when you know we need some help. Endotracheal intubation equipment, well, we've got standard cuffed ET tubes here. This is a spiral cuffed ET tube. This is the stylet that just goes into one of these ET tubes to help give it some solidness so it's easier to put in. And then the Macintosh or the Wisconsin blade or the Miller blade. There's various blades. I gotta think. Physician may also say a straight blade or a curved blade, and the way I remember that is the curved blade is the Macintosh blade. Macintosh has a C in it. C is curved. And the Miller has L's in it, M's and L's, and those are all straight. So if the doctor calls for a Miller blade, you know that's straight. If he calls for a Macintosh blade, the C in there will remind you that that's a curved blade. And if you don't know, you say, is that the curved blade or the straight blade? You know, it's okay. Most of the time they call for it in that manner. The intubation blade, this thing here has a battery in it, and then there's a light that shines right there. And this blade is used, the doctor stands at the head, the patient's head, and uses the blade, I'll show you a video of it in a minute, to pull the tongue out of the way so that vocal cords can be visualized and the ET tube can be threaded in. The patient's position is called the sniffing position. So it's not a hyperextension of the neck, it's more something that jets the head forward. So for me, this is not intubation position. This is intubation position. You can do a little extending of the neck, but it's more of a forward, like I'm sniffing a flower. Not this. Okay, this is not right. This is. Here you can see the handle and the blade is slid in, being careful not to use the teeth as a fulcrum. The tongue is pulled out of position, and then the ET tube is slid between the vocal cords. This is the esophagus back here, here's the trachea, and then when the ET tube is in place, this balloon is inflated that inflates the balloon and obstructs the endotracheal tube. So now the only air moving in and out is through this tube. Now, when this tube is being placed, there is a stylet in there. So as soon as that tube is placed, the stylet comes out. Well, that's a shame. I will post this YouTube link for you to look at, okay? Now, your patient will receive sedation and paralyzing agents unless they're unresponsive already, and then, you know, then it's probably not necessary. And you say to yourself, well, how much sedation, how much paralyzing medicine do I need? Well, that kind of depends on how big your patient is. And then you might consider thinking about what would happen if your patient wakes up at the wrong time. And to that end, I found that slide, although I'm not sure you get the same effect as you would if it was on the big screen. But anyway, that's a big cat. See these big old teeth? And I'm sure that this cat got lots and lots and lots of sedation and paralyzing agent, because I wouldn't want him to wake up in the middle of this procedure. The other thing that I would say about endotracheal tubes is they come in a variety of sizes. And to that end, this little snake has a very tiny little ET tube that they're using to intubate him. I found this on some veterinary site and I thought it was kind of fun. So that is respiratory failure.